It happened back in 1936, Johnstown, Pennsylvania. It was hit by a second devastating flood in less than 50 years. The water rose 14 feet in some areas. Over a dozen people were killed, and total property damage was estimated at over $40 million. Well, to help the town get back on its feet, the government decided to swoop in, and they levied a temporary 10% tax on alcohol sales in the state. All the proceeds were going to go help the poor flood victims. Well, here it is 71 years later. That little tax, that 10% temporary tax, turned into an 18% permanent one that now brings in about $200 million a year to all of Pennsylvania. Not a single red cent goes to help Johnstown flood victims because they're all dead. The reason I tell you this story is because it represents the real story. That when it comes to government intervention, they got no clue. Even when they have the best of intentions, like helping the poor flood victims, or yes, making sure that everybody has access to health care, they always screw it up in the end. I don't know if you've noticed, but once you start giving the government money, you never get a stop. In fact, they usually like to ask for more. Hillary's new mandatory health care plan, ironically titled American Health Choices, may seem like a bargain at only more than double the cost of the entire U.S. Department of Homeland Security. But trust me, that's just a teaser rate, and we all know how well those worked out in the end. The way to solve our health care problem is not to give government more power, it's to give the people more power. Capitalism can find the answer. Capitalism is always the answer. But only if we stop pretending that the government has any answer. Take the airline industry, for example. After the government stopped dictating ticket prices and routes, fares dropped over 40%. Now the market's able to come up with alternatives to the old legacy carriers. One of the alternatives is JetBlue. It has revolutionized the way some people think about air travel, and the brother of JetBlue founder, David Neeleman, thinks he can do the same thing for health care. Dr. Stephen Neeleman is the founder and CEO of Health Equity. I have to tell you, Steve, I heard your solution today, and I think it's brilliant. It's exactly the kind of thing that we would need. It makes all the sense in the world and keeps big fat government's nose out of it. Tell me how it works.
Well, the key, Glenn, thank you for having me on the show. The key is that we need to give people great coverage for major events, excellent coverage for preventative care, and then we need to give them the same tax advantages that we give to insurance companies for paying for routine care. And the center point of this can be a health savings account. The key to the excellent coverage for major events is that when somebody has a big issue, you need to have the safety net there for them. But also, we know that preventative care is the thing that keeps people out of the emergency room. It's the thing that keeps people from going in to see the cancer specialist when you can treat it. And so the problem, though, is that people right now are addicted to what I would call HMOs and things like that, and it keeps them from using these types of plans.
Okay, so wait a minute. I just want to make sure I understand this right. What you do is you pay for catastrophic care. Right. So if I have to have heart surgery, this afternoon, which I might because I think I have a French fry stuck in one of my valves. If I have to have that, then what happens is I get covered by you.
Yes.
But I pay very little because it's only catastrophic care to you.
That's right.
But I also pay a couple $100s a month, and it goes into a savings account.
That's right. And the key to this savings account, it's not like a flexible spending account that's use it or lose it. The FSAs cause people to spend more money because when it's the middle of December and you still have money in your FSA, you head off to the optometrist and buy a bunch of pair of glasses. The health savings account rolls over. You can invest it. You can see growth in that account. It's all tax-free.
Okay. I'm trying to figure out what the problem with this would be. Why would anyone say, no, we should go with Hillary Care?
I think that people are worried that American consumers don't have the ability to carefully shop for health care the same way we carefully shop for other things.
Why? Why does it seem to you at all that people just either don't understand capitalism or don't like capitalism? There's something in America that it drives me crazy. These politicians don't seem to understand the free market system. That there are bad people in the free market system that will screw people. That's what they do. Those people need to be punished. But the capitalist system, the free market system, will always invent the best wheel.
Yeah, I think Milton Friedman said it best. Nobody spends somebody else's money as careful as they spend their own. And what happens is when people are in a free market spending their own money, they'll end up requiring the providers not to rip them off and to give them better deals and better quality.
Okay, so tell me, the one thing that I do hear from people that it makes sense to me is you have people going into emergency rooms, you're going to pay for them anyway. We've got to cover those people. How do you respond to that?
Look, many people, over half of the people that are uninsured in this country right now are gainfully employed. Over half of them have household incomes that are over $50,000 a year. You got to give them an insurance benefit they want to use. People that make money want to be able to have good insurance, and when you offer them insurance that they just, if they don't use it, they lose it every month, then they're gonna turn away from it. We need to give people good options in a free market, and then when they buy those,
and then if they don't use it, then they get that money at the end of the year.
Exactly.
So it's an investment.
That's a
Thank
key.
you very much. Good luck.